Stroke. What is a stroke? A stroke occurs when there is a sudden disruption of blood flow to part of the brain, which causes brain cells to become damaged or die. There are two main types of strokes. Ischemic stroke occurs when a blood clot blocks or narrows an artery leading to the brain, reducing blood flow, accounts for about 87% of strokes. Hemorrhagic stroke occurs when a blood vessel in the brain bursts, causing bleeding, hemorrhage within or around the brain. Intracerebral hemorrhage, bleeding within the brain tissue. Subarachnoid hemorrhage, bleeding between the brain and the thin tissues covering it. A transient ischemic attack, TIA, or mini-stroke, is a temporary blockage of blood flow to the brain. It may cause stroke-like symptoms, but does not result in permanent brain damage. TIAs are often warning signs of a future stroke. Risk factors. High blood pressure, hypertension, the leading risk factor for both ischemic and hemorrhagic strokes. Heart disease, including atrial fibrillation, heart failure, or heart valve disease. Diabetes increases the risk of blood vessel damage. High cholesterol can lead to the buildup of fatty deposits in blood vessels, restricting blood flow. Smoking damages blood vessels and increases the risk of clot formation. Obesity increases the likelihood of other stroke risk factors like hypertension and diabetes. Age. Risk increases with age, especially after 55. Gender. Men have a slightly higher risk, but women are more likely to die from stroke. Family history. A family history of stroke increases the risk. Physical inactivity. Lack of exercise increases stroke risk. Symptoms of a stroke. Recognizing the signs of a stroke early is critical for receiving prompt medical treatment. The F.A.S.T acronym helps identify common stroke symptoms. F. Face drooping on one side. Ask the person to smile. A. Arm weakness or numbness. Ask the person to raise both arms. S. Speech difficulty or slurred speech. Ask the person to repeat a simple sentence. T. Time to call emergency services immediately if any of these symptoms are present. Other symptoms can include sudden numbness or weakness, especially on one side of the body. Sudden confusion, trouble speaking, or difficulty understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or coordination. To diagnose a stroke, doctors may use a variety of tests. Physical and neurological examination to assess symptoms and brain function. CT scan, computed tomography, a fast imaging technique to detect bleeding or other damage in the brain. MRI, magnetic resonance imaging, provides more detailed images of the brain and can show ischemic damage. Blood tests to check for underlying conditions like high blood sugar, high cholesterol, or infection. Carotid ultrasound to check for narrowing or blockages in the arteries leading to the brain. Echocardiogram to check for heart problems that might lead to a stroke. Treatment depends on the type of stroke. Ischemic stroke. Clot-busting medications, thrombolytics, such as tissue plasminogen activator, TPA, which can dissolve blood clots and restore blood flow if given within a few hours of symptom onset. Mechanical thrombectomy, a procedure to physically remove a clot from the brain, often performed within 6 to 24 hours of stroke onset. Antiplatelet and anticoagulant medications, to reduce the risk of further clot formation. Carotid endarterectomy or angioplasty. In some cases, surgery to clear blockages in the carotid artery may be recommended. Hemorrhagic stroke, surgery to repair blood vessel damage or remove accumulated blood from the brain. Medications to control blood pressure and prevent further bleeding. Coiling or clipping for brain aneurysms to prevent rupture. Post-stroke rehabilitation, physical therapy to help regain strength, coordination, and mobility. Speech therapy for those experiencing difficulty speaking or swallowing. Occupational therapy to assist with daily activities and improve independence. Psychological support, addressing emotional and cognitive challenges post-stroke. Prevention. Preventing a stroke involves controlling risk factors, control blood pressure, regular monitoring and medication if necessary. Maintain healthy cholesterol and blood sugar levels through diet, exercise, and medications if prescribed. Quit smoking. Smoking cessation reduces the risk significantly. Exercise regularly. Aim for at least 30 minutes of moderate activity on most days of the week. Eat a healthy diet. A diet rich in fruits, vegetables, whole grains, and lean proteins helps prevent stroke. Limit alcohol consumption. Excessive drinking increases stroke risk. Manage stress. Chronic stress can raise blood pressure and increase stroke risk. Complications. Stroke complications can be significant, depending on the severity and part of the brain affected. Physical disabilities, paralysis or weakness on one side of the body. Speech and language problems, difficulty speaking or understanding speech. Cognitive impairments, memory loss, difficulty thinking clearly, or problems with decision-making. Emotional changes, depression, anxiety, or mood swings. Seizures. Some stroke survivors may develop seizures. When to seek medical help. If you or someone you know shows signs of a stroke, call 911 immediately. Follow-up care is essential after a stroke for monitoring recovery and preventing complications. This may involve regular checkups with a doctor, physical therapy, and lifestyle changes. Living after a stroke. Stroke recovery varies widely between individuals. Some people may recover fully, while others may experience lasting effects. Rehabilitation plays a crucial role in maximizing recovery, but it requires patience, support, and perseverance. If you or someone you know has had a stroke, seeking medical advice and ongoing support is critical for improving recovery outcomes and quality of life.